Assalamu alaikum, peace be unto you, and welcome Imam Abdulkadir. We were just waiting for you. You made it. As our tradition, we will start our program with the recitation from Holy Quran. So Imam Abdulkadir, please.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. فاذكروني أذكركم واشكروا لي ولا تكفرون. يا أيها الذين آمنوا استعينوا بالصبر والصلاة إن الله مع الصابرين. ولا تقولوا لمن يقتل في سبيل الله أموات بل أحياء ولكن لا تشعرون. ولنبلونكم بشيء من الخوف والجوع من الأموال والأنفس والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون. أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون. صدق الله العظيم.
Jazakallah khair. Thank you very much for your kind recitation, and we enjoyed it. Let me give you a translation for what Imam Bazi has just recited. It says, so remember me and I will remember you, and give thanks to me and be not ungrateful. O believers, seek help from patience and prayer. Indeed, God is with those who patiently endure. Do not say that those who are killed in the way of God are dead, for indeed they are alive even though you are not aware. And certainly we shall not test you with something of fear. We shall test you with something of fear, hunger, loss of wealth, lives and fruits. But give glad tidings to the patient, who when afflicted with calamity say, truly to Allah we belong, and to Him we shall return. And such men are the blessings of God and His mercy, for they are indeed on the right path. I also picked up a verse from the Bible, which is really right on the target, considering the situation these days in the world. And it says, whenever I hold back the rain, or send locusts to eat up the crops, or send an epidemic on my people, if they pray to me and repent and turn away from the evil they have been doing, then I will hear them in the heaven, forgive their sins, and make their land prosperous again. It's very self-explanatory. I will not go into detail. I will let the pastor, Keith, explain what are we doing with the pandemic and how we are thinking. I take this opportunity to welcome everyone who are attending our event through Facebook and the YouTube. This is the first time that I'm doing a virtual event. I'm not used to it. I'm very new and I'm making a lot of mistakes, so please bear with me and God help me on that. Just to give you an idea of what is our agenda for the program, we will try to finish it before 7. And once I introduce everyone, then I will introduce our projects, and then I will introduce the topic of the day. The first, Dr. Keith will present his views, then Sheikh Fazal. And meanwhile, I'll request all the viewers to send their comments, send their questions through the Facebook and through the YouTube. Those questions will be picked up by our volunteers and channeled to Dr. Keith and Sheikh Fazal. After the question answer sessions, we will have the fundraising and we will end our event by dua from Sheikh Fazal. Dr. Keith has been living in Kent for 31 years and is a senior pastor of Covenant Church. I met him a few years back. Excellent guy. I loved him from the first sight. He holds a doctor of ministry. He's very popular. And then we have second speaker, Sheikh Hassan. I know him since he was in Bellevue almost 21 years back. And he is well known all over the state. And he is Imam of the Bellevue Masjid since then. On our question answer panel, we have Aftab Faruqi, and we also have Amr Qureshi, and also we have Ikramul Haq. Ikram, I thank you, Ikram, for accepting my request and running this show today. Without you, I wouldn't be even talking over here. And organizers, we have two organizers who are doing this work today. One is in Pakistan, Captain Muazzam Ali Shaheed Welfare Trust is a registered non-profit organization since 1998. And then we have HEMAT, Health Education Monetary Assistance Trust. It is a non-profit organization registered in Washington, and we are waiting for the approval for 501c3. In America, we also have partnered, which is One Ummah Foundation, registered on 501c3. I would like to mention a little bit on the HEMAT. What are we trying to do? Our focus is what the name says, health. We are already supporting the hospital. We intend to have a mobile clinic in Kent, Seattle area. Actually, we started working on it, but then the epidemic started and we had to put everything on the back burner. Once things slow down, we will inshallah start working on it. Education, we are looking at it a little bit differently. We want to focus on the character building of the student and the people, which is totally ignored throughout the world. So that will be our focus. Of course, we will provide the scholarships and textbooks to the intelligent, poor students. In monetary assistance, we have been giving and we will continue to support the orphans, the widows, poor families. And also there are many areas in the world, especially in Pakistan, where there is no water in the area. People walk miles to get a bucket of water. So we are putting water wells and water pumps for the people. We are also providing the means of earning so that people the poor people who have lost everything, who don't have anything, so that they can start earning some money. The directors of this HEMAT, Mr. Aftab Faruqi, Mr. Amr Qureshi, both of them, by the way, they're the IT businessmen. Both of them have office in the United States and in Pakistan. And when we have Dr. Asma Zainab, she's also in Texas. She's ICU specialist and professor in Methodist systems. Unfortunately, as you know, the Houston is really badly hit. And she's working 24/7, 7 days a week. It's unbelievable, under pressure. She apologized, she cannot be here. And then we have Fatma Sheikh and myself. So these are our director. And I want to say one thing. Why did we get together? All of us have been serving different humanitarian projects on as an individuals. So we decided, why don't we organize ourselves and make one organization and let it get registered in America, and then support all the organizations that we have been supporting, the hospital, the orphanage, and so on and so forth. So these are not people who just came in and, okay, we won't, we will be part of him, but they have been doing a lot of work. One thing I want to mention about myself, why I'm involved in it. Actually, it's in my blood. If you look at my grandfather spent his whole life focusing on education, educating the Sikhs and the Hindus and Muslims all alike. And you can imagine his interest in education. He had 7 daughters. He educated each and every one of them. 6 became teachers, and all those 6 married to 6 teachers, and their children, many of them were teachers also. Then came my father, Najibullah. Working with the government, he brought the electricity, the roads, the telephones, and post offices, and you name it, all the necessity for the rural area in the district Jhelum. And then he passed it on to 3 of us, the brother. But the most credit goes to my elder brother, Dr. Major Yusuf Akhtar. Me, myself, and I mean it, and totally insignificant compared to what my father or grandfather and my brother have done. Like in 1984, we opened our first organized project, School for Mentally Affected Children, and today we have more than 100 children. Free uniform, free pickup drop, free education, everything is free, provided to them. Then the son of my brother, Dr. Yusuf, he became martyr and shaheed, and so we opened a hospital. We started operating ambulance in 1996, and 2014 we had a 3-building build, especially for the hospital, and it was inaugurated. Now it's about more than 6 years. And I want to really appreciate all the donors that we have. And our donors are in America, and in England, Australia, in Europe. They're all over the world. But look what our donors have done. Himmat, in the last 1 year, few months, matter of fact, they have been involved. We have been supporting financially, keeping the hospital going. Our support goes to 3,100 families who are totally on zakat, the charity. We have issued them the ID card. It's a family of 4 or 5 person on average. In October, November, we provided food and sewing machines and cows and rickshaws to the needy people who had lost everything in the pandemic and the floods in Pakistan. And last month, we also provided clothes to the orphans. Last month, we provided copies of Quran in the state of Washington prisons and jails. So Himmat is already kind of taking off, although we don't have 501c3 yet. What we're really trying to do is that somehow help the people to break the cycle of poverty. Because when it's poor, there's no income, there's no saving, there's no health, and it just keeps on going in circle. And 2 of my friends, very close friends, matter of fact, Steve Svensson from Washington, Seattle, Graham Zimmerman from Oregon, they're alpinists. They go to K2 and Mount Everest a whole year around. They're climbing the mountains. And I asked them, and during their last trip, I said, why don't you visit the hospital? They visited, and Graham Zimmerman, he made this video for us. Have a look.
My name is Graham Zimmerman, and I am an expedition alpinist. And As an alpinist, I am absolutely in love with the mountains of Pakistan, the Karakoram. And as part of that, I have fallen in love with the people of Pakistan. So it was a really amazing opportunity for me to go and visit the Captain Ali Shaheed Welfare Hospital at the end of my expedition last year. This hospital is located south of Islamabad in the city of Jhelum. Now, this is a very unique hospital because they provide treatment to the needy for free. Walk-in patients go through an interview and they get free or discounted treatment. And as of today, nearly 3,000 families are registered with the hospital and being provided treatment. Our visit to the hospital was very enjoyable and very informative. The staff was knowledgeable and kind, and we were very impressed with the facilities, the technology, and the cleanliness. Offerings at the hospital include general surgery, an operations theater, a dialysis center, gynecology, pediatrics, orthopedics, urology and neurology, laparoscopy, dermatology, OPD and admission, dental, a laboratory that's open 24/7, and radiology that's also open 24/7, and an ambulance and physiotherapy. And I will remind you that this is all provided for free to the needy. I feel that it is very important that hospitals like this exist in Pakistan. It is very important for the future of Pakistan. And I really appreciate all the excellent work that is going on in this hospital and all of those that have given money and time to make this hospital a reality. A big thanks to all the facility and to the admin for a great tour. I can't wait to visit again. Thank you so much.
No, there's another friend, Todd Shea. He's the CEO of CDRS out of Virginia, and he has a big operation in Pakistan. I met him a few years back, and right now he's in Pakistan. He has visited our hospital for 3 times, and I mean 3 times. He just fell in love with it. Whenever he's in that area, he makes sure he stops at the hospital. And during his last visit, he recorded this video through a telephone. The quality is not good, but please bear with me.
Hi, I'm Todd Shea. I'm here in Jhelum, Pakistan at Muazzam Ali Shaheed Hospital, Welfare Trust, which is a wonderful, wonderful place. I'm here with Dr. Yusuf and his younger brother, Yahya from Seattle, introduced me to this wonderful place. And we have Colonel Naeem here, who is doing a wonderful job with the staff of this wonderful hospital that Captain Muazzam Ali Shaheed, before he was lost years ago, he wanted to have a hospital for the poor of this area. And thanks to his family and friends and donors, they made his dream a reality. And I'm telling you that I have been all over Pakistan, and this is the best hospital of its size I've ever seen. 60-bed hospital, and it's comparable to the large, wonderful hospitals in the big cities of Pakistan and even anywhere in the world. The first thing I noticed when I come in to this hospital is the cleanliness. Smells clean, looks clean. They have the signs everywhere with instructions. They have a great staff. They have tertiary care facilities, operation theater, and all of the things that this area needs for the people. When they have a patient who is very poor, they're taken care of as well as any paying patient that would come in the doors. And they have this wonderful welfare program for the most poor who cannot afford services. They get the best care, and they're doing an amazing job. And I hope you will support this wonderful hospital that's doing such a wonderful job. And I thank you, fine gentlemen, and your staff, and Mr. Yahya Saab for doing such a wonderful job for the poor and giving them the health facilities that they need.
Well, that was my thought, the wonderful man. I really love him. He's a great guy. Just give you some facts and figures. In month of November, our expenses were $22,000, and we gave free treatment of $12,000, 8,213 patients. And just imagine what your donation can do. If you pay $30, somebody can get dialysis. You pay only $1.50. It will enable a poor man to see a doctor. And if you want to feed a family, look at it, $25 can feed one family of 4 or 5 person for whole 1 month. So, it is amazing because of the exchange ratio, how little money of yours can do so much for the needy people. I have another video just was sent today actually, and Dr. Asma said, I just couldn't do it, and I just asked my daughter to do that. So I'm going to play it. It's nice. I appreciate her daughter, and both of them, at least this way, she said, I will participate in the event.
My name is Asma Zainab. I'm a physician in Houston, and I'm going to ask my daughter Mariam to present poverty, healthcare, and education in Pakistan.
Some facts. Healthcare in Pakistan currently ranks 154th in 195 countries in performance. Private sector healthcare serves 70% of the population. A common misconception is that public and government sector healthcare is free of charge. The truth is that more than 78% of these patients end up paying out of their pockets for healthcare. In 2018, an estimated 31.3% of the population was under poverty, which was predicted to jump to 40% by 2020. The 2018 survey by World Food Programme showed 36.9% of the population faces food insecurities due to limited economic access by the poorest. 18% of children under 5 suffer from malnutrition, with 82% deprived of minimum number of meals per day. Average Pakistani household spends 50.8% of the income on food, which makes them vulnerable to spending in healthcare and education. UNICEF report in 2016 an estimated 22.8 million children between 5 to 16 years of age not enrolled in school due to socioeconomic disparities. Many children in Pakistan take up low-paying jobs in order to provide for themselves and their family. Should we be choosing between hunger in healthcare or hunger in education? Captain Mozam Ali Shahid Trust visions free health services to the needy without discrimination of religion, race, or gender, educate on preventive measures and healthy lifestyles, awareness of women health issues. The foundation has supported poor families with food program before and during pandemic, support families for education. Please donate. Allah subhanahu wa ta'ala said in the Quran, those who spend their wealth in Allah's way by night and day, secretly and publicly, they will have their reward with their Lord, and no fear will there be concerning them, nor will they grieve. The Prophet ﷺ said, do not withhold your money, for if you do so, Allah would withhold his blessings from you.
Well, thank you very much, Asma. Appreciate it. And your little daughter also, if I can. Okay, all right. Now, one thing I want to say over here that, hunger, education, health, God bless these, the staff that are working there. God bless the donors. We are taking care of all those areas which are necessary to break that cycle of poverty. And you can just look at this one. This is 24/7 fully functional hospital, and it's the only hospital certified by the government that follows 100% specified SOPs and standards. That's a very big certificate for us. And we are also one of the 3 hospitals, and that there are total more than 70 hospitals in the county or district of Jhelum, whatever you want to call it. And we are one of the 3 hospitals, the largest one, which is approved by the government to provide treatment for the poor people, needy people. Our requirement, what are our requirements? Our requirements really, once the pandemic is over, we want to operate dental clinic, and that requires $7,000 per month approximately. Feeding the people, poor people affected by COVID, it's not a fixed amount. Whatever we have, whatever we can afford, we do it. But looking at the previous history, we have done $5,000, $10,000 a month. So we need a lot of it. Even $1 million is not enough. We are installing the solar energy systems, which require a payment of $40,000. And we are implementing health management information system, and to complete that one, we need $10,000. Our expansion plan includes, it's a dream. I hope one day it comes true. If Imran Khan's dream can come true, our small dream can come true also. But establishing a proper nursing school requires about $2 million. So I request everyone to donate generously, and it's tax deductible. One thing I want to mention over here just came in my mind. When I requested Pastor Keith, and he agreed, and I called him back, I said, look, a lot of speakers take some percentage of the donation we collect. I would like to offer you that. And he said, Yahya, I want every penny of your charity go to the poor and needy people. I don't need anything. And so far, for all those 22 years, we have held the fundraising event, but we never paid anyone, and no one ever demanded any percentage. And I hope we will keep that record for the future. Now let's come to the topic of 20s. I call it 20s mainly because I think the history is going to remember how the world lived in 2020, what happened in 2020. And before I go there, some person asked me, why did you pick this one? First of all, that's the requirement, that's the necessity of the people these days. What should they do? What about God? Have we forgotten God? I came to States in 1962. I'm not going to tell you my whole story, but since that time, since 1962, when I was a young student, this America has changed a lot, 180 degrees. The moral values, the family values, everything has gone down the drain. But I have lived overseas in almost, 3/4 of the world I have traveled. This problem is everywhere. Moral values have gone down no matter where you are. What's the reason? What we should be doing with all the calamities? I guess I will leave that to Pastor and Imam Sahib. I found a very small video clip on the internet. It's very interesting what he talks about.
We fell asleep in one world and woke up in another. Suddenly Disney is out of magic. Paris is no longer romantic. New York doesn't stand up anymore. The Chinese wall is no longer a fortress. And Mecca is empty. Hugs and kisses suddenly become weapons, and not visiting parents and friends becomes an act of love. Suddenly you realize that power, beauty, and money are worthless and can't get you the oxygen you're fighting for. The world continues its life, and it is beautiful. It only puts humans in cages. I think it's sending us a message. You are not necessary. The air, earth, water, and sky, without you are fine. When you come back, remember that you are my guests, not my masters.